Okay, so today we're going to talk about the classification of ALL and AML, which will be basically based on the FAB system, which is in most of the courses. So let's talk. So for understanding of the classification, you first need to be know about the hematopoietic stem cell, and it has two series. One is myeloid series and another is lymphoid series. So from myeloid series, we get RBCs, neutrophils, granulophils, monocytes, alright. And from lymphoid series, we do get three cells: natural killer cells, B lymphocyte, and T lymphocytes. Alright. So we need to know the uh, steps in myeloid series and lymphoid series. So myeloid series will be useful in uh, AML, and lymphoid series will be useful in ALL. Alright. So myeloid in myeloid series there is myeloblast which changes into promyelocyte, and promyelocyte changes into myelocyte, and myelocyte changes into metamyelocyte, and metamyelocyte changes into band neutrophil, and finally band neutrophil changes into segmented neutrophil. Alright, in the same way, there is lymphoid series in which lymphoblast is the first one, then lymphoblast change into lymphocyte. Alright, so myeloblast change into promyelocyte and lymphoblast change into prolymphocyte. Alright, then after promyelocyte changes into myelocyte, but prolymphocyte changes into natural killer cell or a small lymphocyte. Alright, and a small lymphocyte changes into either B lymphocyte or T lymphocyte. So this all happens in hematopoietic stem cell, means in bone marrow. Alright, so this is the two lineages of blood development. So now let's talk about the FAB classification of acute myeloblastic leukemia, AML. Alright, so there are 8 groups, and that is M0 to M7, means M0, M1, M2, M3, and their names are very important. So questions are generally asked like, uh, give the classification of FAB with criteria. All right, so if you remember the name, you can easily write the criteria of it. All right, so acute myeloblastic leukemia, first one is M0. All right, so first one main criteria is that there should be greater than 30% of blast cell. All right, means immature cells should be greater than 30%, and this is not talked in detail in Robbins because they follows WHO system. So there is given in detail about the WHO system, but generally old system and old books they refer FAB classification. All right. So M0 is AML with minimum differentiation, means there is you can't differentiate the cells, means precursor, means uh, early cells are found more. All right. So AML with minimum differentiation. M1 is AML without maturation. All right. So there is myelocyte, but there is no maturation. Then M2 is AML with maturation, and M3 is acute promyelocytic leukemia, means there is more amount of promyelocytes, and we have already seen that promyelocyte is one of the um, steps in the maturation of myeloid series. All right, so in this we do find more promyelocyte. Then after in M4 there is acute myelomonocytic leukemia. All right, so it is in the mid of the myelocyte and monocyte. All right, then after the M5 is acute monocytic leukemia, and M6 is acute erythrocytic leukemia, and then after M7 is acute megakaryocytic leukemia. All right, so these are all the names of it. Now, acute lymphoblastic leukemia. So, acute lymphoblastic leukemia generally happen due to the translocation of 9 is to 22, which is BCR-ABL. The same translocation happens in CML as well, but in CML there is a more amount, that is 210 kilodalton. All right, but in this there is a translocation of 190 kilodalton only. So this is the difference between CML and ALL. All right. So ALL is divided into three, and that is L1, L2, and L3. L1 is childhood leukemia. All right, L1 is known as a childhood leukemia. L2 is known as adult leukemia, and L3 is known as Burkitt's leukemia. All right. So this is the three classification. Now let's talk about uh, uh, AML in detail. So there is not only the classification, but they ask criteria based on which you say this is on M1, M0 stage or M4 stage or M2 stage. So let's talk about them one by one. So first of all, there is M0, that is acute AML with minimum differentiation. All right. So what we will find here? Here's simple thing, that is greater than 30% of blast cell will be there, and thereafter MPO is negative. So this MPO negativity is the question of generally that MCQ. All right, and there is also myeloperoxide test that can be also done for this. So myeloperoxide test is negative. MPO is myeloperoxide test. All right. Now you can confirm that it is from myeloid lineage because there is no product differentiation. So you need to do immunophenotyping. Without immunophenotyping you can't confirm that this is from myeloid series. So there is cluster of differentiation 13 and cluster of differentiation 33. These two help us to confirm that this is M0. Now let's talk about M1. M1 is AML without maturation. All right. So there is myeloblast, but there is without maturation. All right. And then after there is more than 3% of blast. Then after MPO and SSB, that is Sudan Black B test is positive. All right. And then after more than 90% cell are myeloblast. So then after there is no significant maturation because it is one of the immature. See, leukemia is generally the thing that immature cells are there. All right. So in this also there is no maturation cell are seen. Then after AML with maturation, so there is myeloblast and promyelocyte, and beyond is also seen. Means there is seen of, we can also in peripheral blood smear we can see myeloblast, promyelocyte, and after of those also seen, but then mainly myeloblast and promyeloblast myelocyte are seen. All right. Then after oral rods are can be seen, and you know oral rods that there is nucleus. All right. And in the side, let me draw, there is like a cell, and in the mid there is nucleus, and inside there are small rods like a structure like this. So these are called OR rods. So OR rods can be seen there. All right. And then after it is associated with T18 is to 21 translocation. All right. And then after it is the commonest type of AML. Which one is the commonest type of AML? M2 is the commonest type of AML. Then after there is maximum chance of coloroma. What is coloroma? The eye of the person is like whitish type, so that is coloroma. So M2 there is a maximum incidence of coloroma. All right. Now let's talk about M3, that is acute promyelocytic leukemia. So again, promyelocytic, in name there is given that promyelocytic, so there is predominance of promyelocyte. All right. And there is, we can see phagot cell. Phagot cell is nothing but there is multiple or rods is seen. All right. Then after translocation is 15 is to 17, and there is high risk of DIC. So most of the MCQs also ask about DIC. So it will ask question like DIC is seen in which stage of AML. So you can say which type of AML. Then you can say M3. All right. This is also one of the question which is asked in MCQs. Then after there is acute myelomonocytic. Again same thing. Myelomonocytic means myeloid plus monocyte. All right. So both myeloid and monocytes are seen. Then after monocyte is greater than 20%. All right. And serum and urine lysosome is increased. All right. So there is increase of serum and urine lysosome. Then after M4, there is one more differentiation of it, that is M4E. Means M4 with more eosinophil. That is written in the M4E0. You can remember, you may leave it, there is nothing required. But these 2 points, abnormal eosinophil and inversion 16, these are very, very favorite question. You can avoid this inversion, that P13 means P large segment of the chromosome and a small segment of the chromosome. So 13th portion is changed with the 22th portion of the large chromosome. All right. So just remember that it is associated with inversion 16. So this is also one of the favorite question of PGs. So in M4 we do C inversion 16. So inversion of chromosome number 16. Now M5. So M5 is acute monocytic leukemia. All right. So monocytic leukemia. Again by name you can remember monocyte means there is more amount of monocyte. All right. And M5 is further divided into M5A and M5B. And in M5A is poorly differentiated and M5B is differentiated. You may remember or you may leave this. Then after there is translocation of 9 is to 11, and then after monocyte is predominant. By the name you can say that. All right. And then after, what is seen here? So there is gum infiltrate means if you see the person's gum, there will be like this granules. All right. And it may be swollen. All right. And this gum infiltrate is also seen in M4. All right. And then after a skin and sinus involvement can be seen. And there is highest incidence of tissue infiltrate, organomegaly, and lymphadenopathy. All right. So this is all about M5. Now let's talk about M6. So M6 is acute erythroid leukemia, means immature RBCs are seen more. So abnormal erythroid precursor will be seen, and that is will be greater than 50%, and there will be dysplastic erythroblast. All right. Now M7, last one, acute megakardioblastic leukemia. So megakaryoblast gives us platelets. So immature platelet will be seen, and this is the least common type, but commonest in Down syndrome. So again, MCQ favorite, which um, uh, which AML is seen in Down syndrome. All right. So M7. This is also PYQ, and it is used to keep asking about this. Now megakaryoblast is seen, that is megakaryocyte, and platelet, and one more thing, platelet peroxidase test will be positive. And again one more thing, that platelet derived growth factor cause myelofibrosis. All right. So as platelet peroxidase is positive, so there is presence of platelet derived growth factor, and it causes myelofibrosis. So that is all about FAB classification of AML. Now let's talk about ALL. So L1, L1 is childhood ALL. All right. And there is presence of a small uniform lymphoblast. Lymphoblast is first one. All right. And then after there will be very small amount of cytoplasm. Means if you will see the cell, maximum amount of content will be filled by uh, nucleus, and there will be inconspicuous nuclei, means a small, there is nucleus and a small nuclei, that nuclei will be very small, and it is most common in children. By name also you can know childhood ALL. So it is most common in children, and it has best prognosis, and it is a commonest type. So this is the commonest type and with best prognosis found in children. Then after L2, L2 is adult type ALL, and there is large pleomorphic blast. So in this there was inconstant cytoplasm and a small uniform lymphoblast, but there is large pleomorphic lymphoblast, and there is irregular nuclei and prominent nucleoli. Means a small that nuclei which was not able to easily, very small in that portion. This is prominent here. All right. And then after, it is more common in adult, by name you can say, and this is the next common type, but it has worse prognosis. Not worst, worse means it is bad than L1, but it is somewhat good than L3. So L3 has the worst prognosis. All right. And there is very large blast cells, and it is deeply basophilic cytoplasm, and there is cytoplasmic vacuole. All right. And surface immunoglobulin test is positive. Then after, the translocation which happens here is T8 is to 14, and it is the rarest type, and it has worst prognosis. So that's all from my side on the topic of FAB classification of AML and ALL. So in Robbins, it is not given in detail. So you need to study. If you want, you can watch the video of Priyanka Satyadev. So she has explained in better way. And for classification, normally the university questions asked based on this FAB classification and criteria of FAB classification. For that, it is sufficient, and almost Around 80% of MCQs can be solved based on this video. So I hope this video might be helpful for you. Thank you. We'll catch in next video.